Dr. Zamora, his patients, Katie, Christina, and Jenny are all joining us. Welcome to all of you. And I want to go through each of you, but Katie, let's start with you. And I'm going to show some before and afters of your procedure, but tell us what your thoughts are on your result in the recovery.
My results have been amazing. I finally feel like I'm back to my old self before I had 2 babies.
Katie, clearly very happy customer. Christina, what about you?
For me, it was really easy, and what I've noticed is, clothes that I normally wouldn't wear now are actually loose.
Jenny, I do want to get to you really quickly, show your before and afters. What are you most excited about?
My results are amazing. It's been 3 weeks, and I feel like I'm back to where I was before I had my 2-year-old.
Dr. Zamora, maybe go through the procedure with us. It looks like you were doing liposuction, but then you're also using plasma to tighten the skin.
Sure. We took out about less than a cup of fat. That's it. And the majority of the treatment occurred because of the plasma treatment.
There was 800 cc's in your canister.
Of fluid, but only about 300 cc's of fat. And anyone who's been pregnant and had the breast engorged from pregnancy and then loses that weight, what happens to your breast when you lose that volume in your breast? They sag. Yeah. And so if we take out too much fat, the same thing is going to happen. Too much fat reduction isn't necessarily going to make it look tighter. And so what this procedure does is it tightens all of that tissue underneath the skin. This is not a replacement for a tummy tuck. However, when you do a tummy tuck, you can incorporate this procedure and tighten all of the skin around that's left over.
How do you feel the plasma differs from the traditional laser liposuction that's been around for quite some time?
Or ultrasonic, or doing liposuction and then following it up with radio frequency skin tightening?
Perfect question. The way those other devices work, radio frequency, ultrasound, laser, is they deliver a lot of heat underneath the skin. And it takes a little while. And in a way that's a little destructive, and some of the results don't last very long. All of this is done in about an hour. And the recovery and the results are really the next day. The pictures that you saw right there are the next day. And so unlike those devices that can increase the temperatures tremendously, it also increases the risk. You can get burns from vaser, you can get burns from radio frequency. You can't really get a burn from plasma. And worldwide, the doctors that have come and trained and performed this procedure haven't gotten any burns because the temperature only gets to 150 degrees. Lasers, CO2 can get to 800 degrees.
So keeping in mind that this isn't a replacement for a tummy tuck, who would you say is a good candidate for this procedure?
So men and women, 20s to 80s, who have loose skin from pregnancy or from just getting older or from getting much older and want to have some tightening without the surgery.
And for our viewers, how much would something like this cost?
Arms started around $3,000. The procedures that they had, $6,000. So it's very cost effective as well.
What's the difference when you're doing, I'll call this body contouring for lack of a better word? I mean, you're not going through a formal tummy tuck. As far as the length of the results lasting, when you're talking about a formal tummy tuck, which is obviously a bigger procedure, as compared to something like this?
Well, you're taking that slack out. When you do a tummy tuck, you are removing that excess skin from above the pubis to the level of the belly button. So that is gone. You are going to stay tight longer. And the other key is that you can tighten everything on the inside. You can tighten the rectus muscle. You can also tighten the oblique muscles to give back more shape, curvature, that Coke bottle type look. And you can do liposuction at the same time. So obviously, I think this is a great option for somebody who does not want the tummy tuck.
Exactly.
For whatever reason. In my hands, I think I could get better results with a tummy tuck.
Well, and I think, again, it gets back to something that you said, which is when you have more tools in the arsenal, you have more options for patients, and clearly 3 very happy patients today. And thank you all for sharing your story, Dr. Zamora. Thank you.